When we heard about the statistic that we were 99th out of 100, I guess it just kind of shocked a lot of us. How do any of us make a significant change in our lifestyle? When we know that something we have been doing has not been healthy, how do we make those changes? What do we want our kids' life to be like in the long-term future? Well, then we got to ask, well, what will it take for us to get there?
Many of these rural communities, if you were to drive around, have a skeleton of what they used to be. They have a heritage of perhaps textile or furniture manufacturing, agriculture, tobacco, and other cash crops, and much of that is gone.
In the last few years, we've changed our philosophy from what I would call a let 1,000 flowers bloom strategy to a more focused, impactful strategy to look at 3 or 4 things that we think could really make a difference and improve the health of North Carolinians. And the Healthy Places North Carolina initiative is our greatest example of that laser focus of having impact on a small population that can have sustainable growth over time.
I'm a native of Halifax County. We're a large county. We've got a bunch of little communities out in the rural areas and everywhere else. Everybody was in their own little spaces doing their own little thing. This initiative has brought us together as a community.
The county health rankings brings their unique perspective of population health at the county level, and they can work with our communities to help them identify their goals.
What has been really exciting with Healthy Places North Carolina, it's not just about the trust having money to provide those communities, but it's about providing support. It's one thing for people to get it, to say, yeah, we know we're not as healthy as we want to be, but what can we do to make it better? And so the County Health Roadmaps is a collection of tools and guidance and resources to help people figure out where to start.
Our health ranking numbers are near the bottom. We want to recognize what they are, things that we can do to help improve those rankings and the health of our citizens. And the health initiative is going to drive us in the right direction in order to do that.
Where we sit right now is an effort that Kate B. Reynolds put on the ground with this Kaboom playground here in Enfield. You know, we want kids to get out and play more. Well, if they don't have a place to play, that's hard to do, but we've got this playground. We've got playgrounds at every elementary school in Halifax County. That's huge. And also they're helping us with their expertise develop goals, how we can use our health departments and our recreation departments and our hospitals and our schools to teach these habits. Weldon Elementary has an exercise room in the school. You know, if they hear about these things all the time, then they're going to take those habits home, and that's going to change things.
When Rural Health Group was meeting with its partners in the community, we were looking at patients who were utilizing the hospital for their primary care. We found they're coming to the ED between 5 and 9 p.m. So we said, well, why don't we meet them where they're at? Instead of trying to change their behavior, let's put a clinic where they go to receive their care. So this is the primary care clinic in the hospital. Not every hospital would want to do this. This hospital recognized that there is a possibility here that would help them, help the patient, and help the whole community.
What's unique about Healthy Places North Carolina is that we are spending a lot of time in the communities, really trying to get to know people that live there, that work there, that play there, and hear what their stories are and how they want to solve health challenges in their area.
You need great leaders to run rural communities. How you make something like this happen is you have to have good relationships with people in the community, open, honest relationships about what's really happening.
And so it's our role to come up with what we want to see for our county, and I think that's the way that it should be. And I think especially in rural areas, sometimes we get kind of xenophobic about people coming in and saying this is what you need to do. And I think that's really helpful that Kate B. Reynolds isn't doing that, that they're really just sort of giving us the tools and connecting us to say, what do you want to do? Okay, here, this is how we can help you do it. But this is coming from us.
Healthy Places NC will look different in every community, and we can't predict what that's going to be. So we have to be willing and flexible to follow the community and support them with the resources that we can bring to bear in achieving their vision.
I'm looking forward to us not being 99th. I'd love for Halifax County to become a model county in terms of what can be done to move the needle. You know, we got the reputation right now of being one of the most unhealthy. Well, 5–10 years, maybe we can be the model that people look at. Look what Halifax County has done for themselves with the help of Kate B. Reynolds. I'd love to see that. It'd be fun.